From the Dasman Board of Trustees, on behalf of Professor Hala, to address the Assembly. I am delighted to see you all here today and would like to extend a warm welcome to His Excellency Matthew Lodge, Her Majesty Ambassador to Kuwait, and to welcome my esteemed colleagues and friends from the UK and from Kuwait. I would like to begin this short address by congratulating the graduates of the University of Dundee postgraduate program in diabetes care, education and management.
I've been here about 56 weeks. Not that I'm counting, but I remember about 53 weeks ago sitting in this audience seeing the first batch of students graduate, so it's great to be back. Unfortunately, His Excellency the British Ambassador can't be with you today. We've got a surprise visit of British parliamentarians. If it weren't for them, rest assured he would certainly be here. We have no excuse not to support Dasman or Dundee University because our office or our embassy is less than 100 yards away. So thank you.
And also to welcome Ms. Wendy Alexander, Vice Principal International at the University of Dundee, who is attending today to represent Professor Sir Pete Downes, Principal of the University. Both Sir Pete and Professor Gary Myers have asked us to pass on their personal message of congratulations to you all. The relationship between the Dasman Diabetes Institute and the University of Dundee, personified today by the Diabetes Care Education and Management Programme, started in 2010 when Professor Hilal Al-Sayer and Professor Kazim Babahani recognised the need for a new approach to tackling the enormous challenge for healthcare delivery caused by the increasing numbers of patients with diabetes in Kuwait, view of the campus. The UK, and as many of the students will know, because we may have mentioned it more than once, this title was awarded to us by the Times and Sunday Times Good University Guide, and in the words of the Good University should be. A statement I expect all of those graduating to do. In the university today, there is a strong emphasis on the professionals, developing the next generation of. We are working together to transform healthcare in Kuwait, and today is an important milestone. The sense of momentum you have developed over the last 2 to 3 years has been remarkable, and reminds me of the words of
For me, yes, you worked hard to reach this turning point in your career. I feel people with diabetes, and in addition to targeting excellency, can now motivate and empower to safely and effectively practice their role in self-management. I feel proud that I can communicate better with my healthcare team, my patients.
Each and every module I undertook during my study had a great impact on me as an educator, a healthcare professional, as an individual. I work as an academic support staff at Kuwait University Faculty of Pharmacy. During my study, I gained an in-depth understanding about educational theories. I learned about new instructional techniques, innovative ways of learning, and throughout last year, I have been trying to transfer this knowledge into my workplace to enhance student learning. As a healthcare professional,
the future belongs to those who believe in the beauty of their dreams. And now, the future. is yours. On that note, I will call upon the students who are awarded a postgraduate certificate in diabetes care, education, and management. Mohammed Rasmi
We're happy and excited today at the Dasman Diabetes Institute to celebrate the graduation of the second batch of postgraduate students as part of the postgraduate program being held at the Institute in collaboration with the University of Dundee in Scotland. We're happy to say that 41 members have graduated, including 12 at master's degree level. This has been under the patronage of the Kuwait Foundation for the Advancement of Science, which has supported the Dasman Diabetes Institute since its inception and continues to support these very important and brilliant programs. We were also blessed to have today one of our Board of Trustee members, Dr. Qays Adweri, to present the graduates with their degrees. Dr. Faisal Hamid Rafai, Director of Clinical Services at the Dasman Diabetes Institute.
Well, we're back right here in the studio, and our guest that we have right now, we have with us Dr. Debbie Wake, and Dr. Debbie is a clinical senior lecturer and consultant physician at the University of Dundee and NHS in Scotland. Dr. Debbie, we'd like to welcome you to our program, Hala, Kuwait.
Thank you.
Nice to have you with us right here in the studio, and you're in Kuwait as part of the team from the University of Dundee in Scotland. Presenting, I believe, here at Teaching Week at Dasman Diabetes Institute. So can you tell us a little bit about the Teaching Week and what's taken place, please?
Yeah, sure. So we've been coming out for about 6 years now to do this teaching programme as a wider collaboration between Kuwait and Scotland to try to improve diabetes care in the country. And we've been teaching, as you saw with the graduation, healthcare professionals, so that's doctors, nurses, podiatrists, pharmacists, also people involved in healthcare management. And they've been progressing through teaching, and some of them have managed to get a master's or a diploma or a certificate. But the Teaching Week itself, we're here for a week, and during that week we do long days at the Dasman where they come for lectures, and we do other interactive activities with them. We do simulation and role play. And it's all just to try to improve their understanding of how to treat people with diabetes better, also to improve their communication skills, their teaching skills, and just to get them better prepared for their work and practice with people with diabetes. So it's been
most of them are healthcare professionals already.
Yeah, they are. So most of them, about 50% are doctors, either working in primary care or secondary care, but we've got a lot of nurses, dietitians, pharmacists, podiatrists, and some who have more peripheral roles in laboratories or people who are helping organise healthcare. So not all healthcare workers, but the majority are, yeah.
Dr. Debbie, tell us a little bit about the classes that you're presenting during this week, please.
Okay, so as a diabetologist myself, it's very clinically orientated, so we're teaching people about various aspects of diabetes, helping them understand what is diabetes, why do people get diabetes, what are the risk factors for diabetes, and then thinking about the complications, eye problems, feet problems, kidney problems, how we can prevent these happening, and what are the most effective treatments that we have available to try to both prevent diabetes and to treat diabetes and its complications once it develops. So that's been the big focus of my teaching this week.
And how have you found the participants? Have they been
Fantastic.
eager, wanting to learn? Has it been interactive? Tell us more about that.
We love coming to Kuwait. As I say, we've been doing it for 6 years. We come about 3 times a year to deliver the teaching, and we're always impressed by the students. They are amazing. They are so enthusiastic about diabetes care. They want to improve healthcare. They really want to make a difference. They want to do the best for their patients. So they really engage with the teaching. We have lots of fun, as we say. We don't just have them sitting in lectures listening to us. They're participating. They're doing workshops. They're doing role play. We do games. We have all sorts of way of teaching that's really interactive. So it's great fun.
Well, that's good to hear. I'm glad everyone's having a good time and learning. And yesterday, Sunday, the 31st of January, was the graduation ceremony at Dasman Diabetes Institute.
Yeah.
We saw that great report before we came on air. Looked like a full house there. A lot of the graduates, their family members, the staff at DDI, the higher management. Tell us a little bit about that graduation ceremony. How was the function?
Yeah, it was fantastic. Yeah, we had a great day, as you say, full house. And it's always great to be able to stop and celebrate, because when we're really busy on the programme, you know, sometimes we forget to stop and say, gosh, everyone's doing really well. So we had about 60 students graduating, some of them at master's level, some at diploma, some at certificate level. But in total, we've had about 300 students either come through the programme or actively on the programme. So, and every time we come, there's another 30, 40 students. So the graduation itself was great, lots of fun, lots of celebration, and the students should be very proud of what they've achieved, and I think they were, and their families were very proud. It's unusual for them to be able to get a postgraduate qualification here in Kuwait whilst they're working. Often they have to go abroad for the chance to get a qualification. So I think the fact that they can do this in Kuwait, get their degree here, attend graduation here, they're very grateful for the opportunity to do that.
And we'd like to take this opportunity, of course, to congratulate all the graduates and wishing them all the best of luck in their future endeavors and careers. And Dr. Debbie, you know, you've, as you said earlier, been coming out to Kuwait almost, I believe, from the start, about six years ago when it started. So building up this strong collaboration. So how have you noticed the things change and so forth the past 6 years?
Yeah. We've seen a lot of changes. I think, as everyone is aware, in Kuwait, diabetes is a big problem, and the prevalence continues to rise. So
Kuwait and worldwide also.
And worldwide, yeah. So here I think you have about 1 in 4 adults with diabetes. In Scotland we have 1 in 20, it's slightly less, but in every country in the world it's increasing. So
why is that?
It's a combination of things. It's one of the big drivers is obesity and fast food, unhealthy food, and more sedentary lifestyle. So people are less active, people are sitting more, they have jobs which mean that they don't move around so much, and the diet isn't so good. High fat, high sugar in the diet. So I think we see that all around the world. Also people are living longer, that's important too. So as you live longer, your risk of diabetes increases. So it's partly due to an ageing population. But the main big issue is lifestyle, and that's one of the things that we really need to try to impact on. So I think that's been the negative side of the last 6 years, in that we continue to see diabetes prevalence rising. But on the plus side, we've seen huge differences in the way that diabetes has been treated in Kuwait. So better understanding about treatments, better understanding about how to prevent complications of diabetes. We go out to the polyclinics as well and do a lot of teaching with people in the polyclinics.
How is that? How have those experiences been?
And it's very different.
Going out of the boundaries of DDI.
Absolutely. Very different to Dasman Diabetes Institute. But it's great to see how clinical care is being delivered in practice, because we need to understand where our students are working and the tools that they need, the environment they're in. So we go and we try to do teaching every time we come out in the polyclinics. But we've noticed a big difference. Every time we go, their knowledge is better, the understanding is better, they have more systematic processes in place for treating diabetes. So the knowledge is undoubtedly increasing, and I think as a consequence of that, diabetes care must be improving. We've also, as a part of the programme, we get students to do workplace projects. So they have to do something in their workplace to improve diabetes care. And that's what we use as an assignment, for a test for an exam for the programme.
Okay.
So since we've been coming...
How's that been going?
It's great. It's great, and it means the students are not just learning knowledge, but they're actually putting it into practice, and they're making a change. So we've had over 1,000 workplace projects have happened as a result of the last 6 years of the programme. So we hope that that's making a difference in the actual clinical setting in Kuwait, that actual change is happening through these workplace projects. So we're very proud of that and the achievements of the students in doing that as well.
And this teaching week, I believe you're about halfway through.
Yep, that's right.
It's been going well so far?
Yep.
You've come at a bit of a cold time For Kuwait, that is.
It is.
Where for you, probably it's not that cold.
It's
Running
not so
from
cold.
Scotland.
It's interesting. We always say Kuwait and Scotland have a lot of similarities.
Yes.
We have a similar sized population.
Okay.
The healthcare systems are similar in that there's free at the point of care. But we always say one thing that's very different is the weather. But this time we can't say that.
There was one day, I think, this past weekend here in Kuwait where it was almost the same temperature.
I think that it was colder when we arrived in Kuwait than when I left Scotland, and that's unheard
That's something
of.
you probably won't ever see again.
I know.
Very rare. But
Very
so,
rare,
So
yeah.
nice to have you and the team right here in the state of Kuwait. And you are, of course, a diabetes specialist, also very keen on research and so forth. So also, if you could share a little bit about the research that you're doing and some of the projects that you may be collaborating on with Dasman also.
Absolutely. So one of my big interests is how we use technology to improve diabetes care. And I know here in Kuwait you're very keen on your technology, your mobile phones, the internet. We're interested in how we can use these sorts of tools to try to prevent diabetes, but also to help people with diabetes. So we have a number of projects that involve using apps on phones, using mobile health, using text messaging to try to motivate people, to give knowledge, to give them understand better the lifestyle factors, the diet, the exercise, to understand what they need to do. And also an important thing is about our healthcare records. We're very lucky in Scotland that we have a healthcare record for the whole of Scotland for people with diabetes.
Great.
So that's great for research, but it also means that our patients can access their health records. So they can go online, they can look up their results, they can find out about their clinical care, they can look at the letters that have been sent between the doctors, and that improves the knowledge of the patients. And we've been in Kuwait, we've also been trying to work to say, can we improve the health records? Can we improve the records for diabetes care so that primary care doctors, secondary care doctors can share information better? And also patients can access that information better so that they understand their condition, they access the resources they need. Because self-management is really important in diabetes. It's about patients understanding their condition, knowing what they need to do. Only so much we can do as healthcare professionals, but if the patients can take that on themselves, that makes a huge difference.
And that sometimes take a little effort
It
to get the patient motivated and that to better take care of themselves, right?
That's it, and that's one of the biggest challenges in diabetes. A lot of it, so much of it is about self-management, and it's very difficult. We all have competing priorities in our lives, and trying to get people to make their health the most important priority is difficult, because we all have pressures from social activities that we do and pressures from peers, and sometimes that goes against the best practices for your health. So it's a big challenge.
So Dr. Wake, what can the patients, the people who have diabetes, how can they better self-manage, take care of themselves? What advice do you have for them?
Yeah, so I think there's some very simple things that people can do. I think it's about trying to stay active, and for some people that might be taking up a new sport or going to the gym, but for other people it might just be not sitting so much in a day, standing up, moving around more,
Instead of
active.
taking elevators, maybe take the stairs.
Absolutely, yeah. If you can walk, if you can take the stairs, little things like that can make a big difference. And just looking at the diet as well. I know that it's very tempting, all the high sugar, high fat foods, but just thinking a little bit more about the diet and saying, can I do without that? Can I reduce my calories a bit? Can I choose a better choice?
So now, what do you mean by diet? What kind of tips would you also give about that, please, so people can better take care of their diet?
Yeah. So I think simple things again. If you're going to do something simple, looking at can you reduce the amount of sugar in your diet? So there's lots of options in terms of drinks that are no added sugar, that are light drinks, rather than the full sugar Coca-Colas and things. Look for options with no added sugar.
Well, avoid those soft drinks.
Avoid the soft drinks. Avoid the high concentrated fruit juices. A lot of sugar in that. So the obvious things, the cakes, the biscuits, the sweets. Try to substitute at least some of those for more healthy options with less sugar. And I think simple, small changes to the diet like that can make a big difference in terms of both preventing diabetes, but also helping keep the sugar levels low if you do have diabetes.
I think exercise is very essential also, correct?
Yeah, activity is really important. If you're more active, you burn through the calories, you keep the sugar level down, and it means you're at a much lower risk of developing diabetes. So activity is important. So I think we would recommend that people should be active, do moderate to intense exercise at least 5 times a week for half an hour. that would be a minimum of what people should be doing. So I think people should be thinking, can I incorporate that into my daily work pattern? Can I go for a walk at lunchtime? You know, can I take up a new sport? Can I dedicate a bit of time each day to exercise, just so that it, you know, it can really have a benefit for the health?
Yeah, I think diet, exercise, getting active are all keys to
Absolutely.
try to prevent diabetes. And if you're, let's say, borderline, there is ways you could just go back, reverse it, correct?
There is.
Is that true?
That is true, and I
That's
think
not a myth then,
that's not a myth.
Okay.
And I think that's a really important message for patients. So if you are in the process of developing or have just
It's on
developed
the
diabetes,
increase,
if you then take on board all the lifestyle advice, you get your body weight down to normal body weight, you lose the weight, you really look at the diet and improve things, you can reverse diabetes. So that's a really strong message for patients, and we didn't used to say that, but now we can. So don't think that once you've got diabetes or when you're on the verge you can't do anything about it. There is a real chance if you sort out your diet, your lifestyle, that you can reverse diabetes. So yeah, I would encourage people really strongly to do that.
Dr. Debbie, as we're coming towards the end of this interview segment, do you have any last words or comments for the audience watching Hala Kuwait about the program, diabetes in general? Please feel free.
So just to say that we've got this fantastic collaboration, and I hope that's going to continue between Kuwait and Scotland. We've got a lot to share, we've got a lot to learn from each other, and hopefully we'll be continuing to progress that over the next few years. And I would encourage healthcare professionals out there, if you want to take part in our programme at the Dasman, please get in touch. We're always looking for new students who are keen to learn, and hopefully that will make an improvement in the diabetes care for patients.
Sounds good, and we appreciate your time with us. We know you have a very busy schedule, and you've got to get back to the Institute now for a class.
That's right, yeah.
We really thank you so much.
No problem, thank you.
Thank you for joining us. We were speaking to Dr. Debbie Wake, clinical senior lecturer and a consultant physician at the University of Dundee and NHS in Scotland. We do appreciate her time with us right here on Hala Kuwait. And with that, we pretty much come to the end of tonight's episode. I hope you enjoyed all that we brought to you on tonight's program. Make sure to enjoy the rest of your viewing this evening and all throughout the week right here on KTV2, the family channel. Before I leave you, remember to always take care of yourselves and each other, and let's always remember to respect one another. Have a nice evening, and good night for now.